There are certain risk factors that can contribute to retained reflexes. First one is genetics. So, a family history of ADHD or autism, other learning challenges could be a contributing factor um, to having retained reflexes in an individual. Number two is stress during pregnancy or birth. Threatened miscarriage, induced labor, prolonged labor, C-section deliveries also put a baby at risk for having retained reflexes, because some of the purpose of those reflexes is to help the baby during the birthing process, and that movement kind of down the birth canal helps to integrate those reflexes. And when you have a C-section baby, they didn't get that experience. So a lot of times we see that as being a risk factor for retained reflexes. The third is environmental factors that could happen within the first 2 years of life, because again, those reflexes are there to protect us and they integrate through movement. So if a child maybe had restricted movement in the first few years of life, we see this with NICU babies that were in incubators, or when I was the director of the Irvine Center, about 20% of our population of students were actually adopted. And it's the case with students that were, or children that were adopted maybe in foreign countries where there were still orphanages and they didn't get a lot of stimulation or didn't have a lot of room to move around. That can cause retained reflexes. Any extra stress during the first 2 years of life, again, because those reflexes are there to protect us, can cause the reflexes to remain past the time that they're no longer needed.